So I am Dr. Sara Thomson. I'm an OB hospitalist here at Saint Alphonsus Regional Medical Center. And I want to talk to you today about having a baby during the pandemic. The first thing I wanted to tell women out there is that I know 9 months ago when you were taking a pregnancy test and you were in your bathroom watching for that positive test result to come through and feeling all the emotions about how your life was going to change for the rest of your life, you had no idea that you would be having your baby in the midst of a pandemic. As a mother and as a woman, I do understand that this can be really difficult, and I'm sorry that you're having to cope with all these extra emotions that the pandemic has created for us in terms of unknowns, fears, and anxieties. Saint Alphonsus, everybody who works here on labor and delivery feels really passionately that birth is one of the best of the human experiences, and we want to make that birth experience still joyful for you, despite all the changes that have happened with COVID-19. Because your baby is going to be leaving the security of your womb and coming into the world where we're coping with this pandemic, we have made some changes in our policies that we've adjusted along the way based on what we know about the virus and also the change in the disease prevalence in our community. So it's important for moms to know that while we mourn with you the fact that we can't have a full waiting room full of family members anymore, and we can't see little children coming in to meet their sibling for the first time, we still want this to be a good experience. Because we're trying to protect most of all newborn babies, but also mothers, fathers, and healthcare workers, we are limiting the number of visitors that can come to the hospital currently. So we at Saint Alphonsus feel that it is crucial for a woman not to feel alone or unsupported in her birth, and that is why we've been committed throughout the pandemic to have one support person allowed per woman during her labor experience. Most of the time, women are choosing to have the father of the baby present as their support person, but depending on circumstances, they may choose somebody else. That support person we screen to make sure that they're feeling well, that they don't have a fever, and that they don't have any symptoms of COVID-19. Again, the reason for that is to keep everybody involved safe. So a woman's chosen support person does need to wear a mask the entire time they're in the hospital. And we're also asking that the support person limit their trips back and forth to the in and out of the hospital. And we know that sometimes there's something that's forgotten or something that needs to be taken care of external to the hospital, and understand that. But we just want to limit traffic to keep everybody safe. For the mom, when you get admitted in labor, we do want you to wear a mask initially. We recognize that when a woman is in labor, it can be really difficult or even impossible to keep a mask on while you're going through the labor process. I also have had some moms share with me that even though the experience is different, it's been good in other ways in terms of our visitor policy. It can be a stressor for moms right after they deliver a baby to put themselves together to accept a large number of visitors. And this does allow the experience to be a little bit more intimate and private, at least for the first day or two that you're in the hospital with your baby before heading home. Thank you so much for watching this video, and I look forward to participating in your care and giving you the best birth experience that we can during this difficult time.